Good afternoon. I am Ross Angelo Negrillo, a medical intern. Today, let us explore the case further and discuss more aspects in the case presented earlier. As a mental health advocate, this hits close to my heart, so it would be a more personal take and view on the case. We have seen the case of a 43-year-old male with chronic schizophrenia for 20 years. His worsening condition made his mother seek compulsory treatment. Thinking of the best interest of the patient, a risperidone was prescribed by the psychiatrist in liquid form that can be added to patient soup without the patient's knowledge. This treatment produced good results. While the physician is acting for the best interest of the patient, this aspect of psychotherapy is highly medicalized. The physician must balance between his or her medical knowledge and the patient's autonomy. The physician should have talked to the patient first and determine competency in decision-making because, as mentioned, not all patients with schizophrenia lose clear cognition. Yes, the treatment produced good health outcomes of the patient. However, the end does not justify the means. What if it was not the patient's desire? What if the patient wanted another treatment plan? We will never know because there was no communication between the patient and the doctor. The doctor-patient relationship should be founded on trust and good communication. One aspect of the case we can look at is why the patient refused to seek consult. This could fall under health-seeking behavior, which is defined as a sequence of remedial actions that individuals undertake to rectify perceived ill health. Several factors affect health-seeking behavior. This includes access to healthcare, patient's insight on his or her illness, influence of peers, family, and friends, and many more. The Anderson model of healthcare utilization is an expansion of the health belief model. This model describes and predicts one's utilization of healthcare services. Factors include predisposing characteristics, enabling resources, and need factors. Under predisposing characteristics is one's attitude and perception towards illness. This is where the stigma on mental health difficulties comes in. Stigma is a very huge factor in health-seeking behavior of individuals with mental health difficulties because having a psychiatric diagnosis itself has underlying social implications. It causes self-doubt, reluctance to seek help, reluctance to seek treatment, subjects people to harassment and bullying, deprives family members of deeper understanding of one's mental health problems. In fact, in 2018, 60% of Americans thought individuals with schizophrenia were likely to be dangerous to others. 68% believed that of individuals with alcohol dependence, and 30% believed that of individuals with major depression. This hampers health-seeking behavior of people because they are labeled to be dangerous and harmful when in fact they just need help. Let us talk about the mental health in the Philippines. 3.3% of the total population suffer from depressive disorders, 3.1% from anxiety disorders. In 2012, there's a report of 2.9 suicide cases per 100,000 population. In our country, we have 60 psychiatric healthcare facilities and there is an estimated 2 mental health workers per 100,000 population. Is Philippines a mental health friendly country? I don't think so. The Philippines is not spared from the stigma attached to mental health illnesses. Mga millennial, gawa-gawa lang yan. Nagdadrama lang yan. Nag-iinarte lang yan. Naghahanap lang yan ng atensyon. These are just some of the phrases we hear from Filipinos today. This is saddening, but these scenarios happen in real life. Philippines, as a product of colonialism, produced many cultural beliefs, one of which is that depression and anxiety are non-existent. In 2018, Tanaka showed that the stigma consists of three themes. First, familial problems wherein family rejects or disowns the family member who suffers from a mental disorder because they believe that it can be inherited. Second is unrealistic pessimism and optimism about the severity of the disorder, wherein the mentally ill either would certainly suffer from severe functional impairment or would be able to overcome any psychological suffering by themselves. Last is the oversimplified chronic course, wherein people without mental illnesses apply an acute illness model to those ill and expect full recovery in the short term. So how do we move forward? What are the things we need to do to destigmatize mental health problems, especially in the Philippines if stigma is ingrained in our culture? How shall we break these ideologies and reform them to a more progressive one that is responsible, kind, and understanding to anyone? How can we make Philippines a mental health friendly country? People are judgmental because they do not know what mental health is. The first step is to talk about mental health, raise awareness. As healthcare professionals, we have the privilege of understanding mental health. We should start discussing mental health to our patients, our families, and friends so they will acknowledge its existence. Mental health education has to be institutionalized as much as possible. Second, practice empathetic listening. For a person experiencing a mental health problem, having an empathetic listener can be calming and reassuring, even healing. When we listen with empathy, we focus our attention on the other person in an attempt to understand, interpret, and feel what they are telling us. We must be careful to listen with the goal of understanding and not imposing. Talking about mental health can be challenging because it requires us to be sensitive. We must be careful and avoid using mental health as adjectives. This is part of recognizing that mental health conditions are complex and nuanced. Moreover, people are more than their conditions. By saying, she has depression, rather than, she is depressed, we recognize that someone is a person first before their condition. A person-centric language could help us alleviate the stigma. Again, language is a powerful tool, a double-edged sword. It may help us destigmatize mental health conditions or exacerbate the stigma further. Especially in the Filipino language, you would often hear a lot of people casually use the words baliw, siraulo, may tililing, and a whole lot more harmful descriptors which should never be acceptable in the first place. Next is policy and legislation. A policy is effective if we see behavioral change in the population according to the goals of the law. Let us welcome and acknowledge the passage of mental health law in the Philippines. This law is an integration of mental health laws from other countries. It empowers rights of patients with mental health conditions, their relatives, and service providers. Let me reiterate the World Health Organization's definition of health. Health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Mental health is as important as physical and social health of an individual. There is no health without mental health. As healthcare professionals, we have a responsibility to bridge the gap between physical health and mental health. We must take action in transforming our healthcare system that utilizes a coordinated and multidisciplinary and holistic approach, whether it's in the clinic, hospital, or community. And finally, we need to dig deeper. I quote Dr. Omid Shamard from another medical institution. May we not only have clinical eyes that see signs of diseases, but critical eyes that see the signs of injustices and conditions of the people we meet. Whether it's physical or mental health, we cannot just treat the illness and then send our patients back to the same conditions that made them sick in the first place. Thank you very much for listening. Have a wonderful day.